Welcome to the Creating Health Show. I'm Dr. David Haase.
We are here at IFM's energy module for 2019, and I am sitting with one of my co-faculty and my dear friend and beloved colleague, Terry Wahls. We've gotten to teach together now, 5 years?
5 years, yeah.
Yeah.
It's very fun.
Yeah, it's been very fun. And been able to, what we're exploring is the role of all the different types of energy and how it interacts with neurologic illness and our general well-being, along with mitochondrial function. Been a great conference, but you're always my highlight.
Oh, thank you very much.
Yeah. So I want you, if people don't understand who you are, you have had this amazing transition from wheelchair to now a clinician that is teaching doctors and patients on how they can use diet and lifestyle to transform their neurologic health.
Sure.
Yeah. So I'm fascinated because you're running a conference. You're actually leaving this conference and going to
run my conference. Yeah.
So tell me a little bit about this conference and what needle you're wanting to move next.
Why don't I go back, just real briefly tell you my story. So I have relapsing remitting MS that was diagnosed in 2000. I'm a conventional internal medicine doc. I don't believe in special diets or complementary alternative medicine. I go find the best center in the country, see them, take their newest drugs, go steadily downhill. They tell me about the work of Lauren Curdane. I adapt, read his papers, decide it's maybe a reasonable thing to try. So after 20 years of being a vegetarian on a low-fat diet, very heart healthy, I decide I'll go back to eating meat. And I continue to decline. The next year, I need the tilt-recline wheelchair. I take mitoxantrone, a form of chemotherapy. I continue to decline. Then in 2004, I take Tysabri. I continue to decline. Then I'm switched to, again, another disease-modifying drug. I continue to decline. At this point, I start experimenting. But fortunately, I was tuned into the mitochondria. So I've taken a bunch of mitochondrial supplements, and I figure out that those supplements help my fatigue a little bit. I continue to decline, but more slowly, and so I'm hugely grateful. In 2007, I'm so weak I can't sit up anymore. I'm beginning to have brain fog, and that's when I discovered the Institute for Functional Medicine. I take their course. I have a longer list of supplements. I discover electrical stimulation of muscles. I add that to my physical therapy. And then I have a really big aha, like, what if I redesign my diet much more specifically based on everything that I've learned so far? And so I do that. It takes more research, by the way, but I do that. And it's stunning how quickly things change. My trigeminal neuralgia is manageable within 3 months. My brain fog is gone within 3 months. My fatigue is gone within 3 months. And I'm beginning to walk with a cane. And then in 6 months, I'm walking without a cane. And in 9 months, I'm biking for the first time in probably about 6 years. And in 12 months, I'm doing an 18.5 mile bike ride. So, of course, this changes how I think about disease and health. It changes how I practice medicine. And then I begin, talking a lot more about diet and lifestyle, less and less about drugs. I'm teaching the public, and then my chief of staff calls me down to his office and says, "Terry, what the hell are you doing? People are really getting upset with you." And so I have to explain what I'm doing. And fortunately, I'd sort of prepared for this. So I had a stack of scientific papers I'd gone through with him to explain what I was doing and why. And he became a huge fan. But it was quite a transformation from being a steep skeptic to, becoming profoundly disabled to getting my life back.
Wow.
Now,
so can I just ask, I want to go back to being a skeptic. Because you're a real person of science. There's no, I never have to worry when I ask you a question that you're going to fluff it up or hedge. You are as direct of a human as I know when I'm communicating talking about complex things. So what was it like being a skeptic and then?
Well, what happened, I'm getting more and more disabled, and I'm like, well, I got to do everything that I possibly can. So I started reading the science, and I'm looking for originally drug studies, and I realized, well, that's silly, I can't access these new drugs. So I should start reading science about things I can access, which got me down the path of reading vitamin and supplement studies for any neurodegenerative disease. And then I began like, okay, if I'm fixing my mitochondria, what papers are out there about fixing mitochondria? So it was always mouse and rat studies that would have to translate into human-sized doses. And because I hadn't discovered IFM yet. So, I'm driving my primary care person a little crazy. Because I come in and say, okay, I'm going to add these supplements now. She goes, okay. Let me check for cross reactions, adverse events, and fortunately she was patient with me, and I kept adding stuff. And after 6 months, not much had happened, and I was like, I'm wasting my money. The Skeptics took over, and so I quit taking everything, and I couldn't get out of bed. And after 3 days, Jackie came in and said, honey, I think I ought to take your supplements again. And I took
that
them.
Fast.
And I could get up and go to work. And I thought, wow, now that is really interesting. So 2 weeks later, the scientists wanted to do it again. So I stopped everything. And, again, I couldn't really function. It takes about 36 hours. And the floor fell out. And so now I am totally excited about, I'm figuring stuff out that my neurologist and my primary care doc were not telling me. So that got me very excited about reading the basic science and being willing to go on this journey. So then when I discovered IFM, I felt like I hit the gold mine because I was so excited to take that neuroprotection course and have more tools. And I'm so excited that IFM is talking about mitochondria and cellular health. So that was just a phenomenal turning point in my life.
Wow. Fascinating. Because I came to functional medicine via PubMed. And so it was the science. I was like, oh, wow, why aren't we paying attention to these papers? Because it's really pretty fascinating.
It's
going back to original physiology.
Correct.
And
a lot of basic science research is all about drug development, one isolated pathway. What I find so compelling about the IFM's approach is it's not about one pathway. It's about the entire system, in the complexities of the entire system, and self-correcting, self-moderating biological impact of this very intricate network.
And that network has a resiliency of its own.
Correct. And making little supports to the entire network is quite profound. As opposed to a big impact on one small part of the network.
And how do you explain briefly how you do this in a large scale manner? Because I adore your approach. I think it is really transformative for healthcare. It's a model.
It was such a blessing to be at the VA. So
So let me be clear that you're a professor at the university, a clinical professor at the University of Iowa, and
correct.
We're at the VA.
And I was at the VA for many years, 17 years, 16 years, 17 years, somewhere in that number. Once I had my own transformation, I used these concepts in primary care and then in the traumatic brain injury clinic. But I couldn't do any fancy functional medicine testing. I didn't get any more time with my patients. In fact, in my traumatic brain injury clinic, I got 20 minutes twice a year, no labs, but I still use these concepts. And I got you could really tell who I saw because they recovered. And who everyone else saw just continued at the same level or got worse. And so that was quite striking. And then in primary care, I'm really talking about, biochemical pathways, and my residents think I'm going to talk about the newest drug, and I'm talking about broccoli and curcumin and meditation and stress reduction. And so I'm talking more and more to my patients about diet and lifestyle. And what the residents discover is I'm incredibly effective getting these vets to make very big changes step by step in their lifestyle. And they see diabetes regress, hypertension regress, heart failure regress, and so that was interesting to watch. Then the chief of medicine, calls me in to say, Terry, we got to take you out of primary care. And I'm like, okay, because I want you to have your own clinic. So the VA lets me design a clinic. We called it the Therapeutic Lifestyle Clinic. I go to the pain clinic, I go to primary care, and I say, give me your most difficult patients, They're not going to get drugs. And no, so we're just using diet and lifestyle modification. And I start getting a few, and I have amazing success. And then I start getting more. The VA is dialing back the access to opioids. So pain clinic is sending me more, and I'm having remarkable success. So now I start having waiting lists, and I realize, okay, I'm going to need to get more people through. So we create group clinics, and I get more and more skilled with the group clinic. And so we began to have really a very large, comprehensive process of intake clinics with a large group clinic, a intake clinic where I would evaluate folks and teach them how to complete their own timeline and matrix. So I had to redesign the form so we could do that in a group. And then we'd do a little cooking class, help them reimagine their relationship with food. Then we'd see them in support groups where they could talk about their success and their failures, and we could do some coaching. Then we have skills classes where we talk about the factors that improve resilience, and some movement classes, some cooking classes. They taught me so much. And one of the key things is you can do these concepts without labs. You need to have hope, inspiration, and metaphors that your population will understand and relate to. And group visits enable all the positives of peer-to-peer support. And then it taught me how to teach these concepts to groups. Then at the same time, I began having a group, basically a large group consult, functional medicine consult for the public when I started running the Wahls Protocol seminar. We've done that 5 years, 6 years. We'll be having our 6th one this year. We'll have over 300 folks there. And I'll do this group functional medicine consult. People come back year after year because they're so inspired, and they keep setting new physical health goals and new goals for what they're going to do with their therapeutic diet and lifestyle.
Wow.
It's amazing.
Exactly. And I think that what I love is this idea of how we create health. The body is miraculously designed to be able to create itself and then knit itself back together with challenge, and we so underestimate our capacity to heal. And all of us have that. I think of it every day, we're having degeneration, and then if we have a little more regeneration than degeneration, we're literally turning back the clock. And you, my dear, look younger every year I have seen you.
Yeah, my kids laugh like, oh my God, you're a Benjamin Button. You are looking younger and younger. They laugh that I'm going to start being younger than them. But my hair is getting more white, so my hair is not youthening, but it does appear the rest of me is.
That's awesome. Yeah, because really what aging is more degeneration than regeneration. So you are really unaging in many ways.
I talk to my patients that life is a series of self-correcting biochemical reactions. And so the more we can create all of the building blocks necessary for those self-correcting chemical reactions to happen properly, you will rebuild a new and healthier you molecule by molecule.
And since you are what you eat has eaten,
yes, absolutely.
You actually become a new entity.
A new entity.
Yeah.
In my book, I took the time to go through and research. It takes about 20 years to replace all the molecules in your bone, and about the same amount for your teeth. Of course, our mouth and our gut, we replace about every 5 to 10 days. I think the brain is 7 years. So there's continual turnover. So even if you're damaged now, if you provide the proper building blocks, you're going to be replacing it with the correctly made one. What people often don't realize is we can't make all the molecules that we need. Because we had mutations in the past, so we rely on our microbes to supply a bunch of these molecules. And if we don't have a healthy microbiome, that replacement process doesn't go very well. So I spend a lot of time talking about poop.
A lot of time talking about poop.
Yeah, poop is so important.
And you had one of the greatest. We had a great question today in the session asking about, well, can't I just juice all the vegetables that you have? And you gave almost a verbatim reply of what I have said over years. And
yeah.
So what do you think about juicing?
Well, if you juice, go ahead and do that. Dump out the juice and eat all the fiber that's left, because it's the fiber that is feeding my microbiome, and I need my microbiome to be happy. So I can get all the molecules that mammals can't make anymore, that we rely on our microbes to make for us.
Mm-hmm. This massive metabolic factory that we carry along with us all the time.
That are absolutely critical. So if you are going to juice, I would just use a Vitamix so that you keep all the fiber in the juice. You can make lovely smoothies. You can do that. That would be fine.
That's great. You know, I have a Vitamix that's 26 years old. And when we first got it, it was in our little tiny apartment, and when it was still in Vanderbilt Medical School, and we were in this tiny little apartment, and we plugged it into the wall, and every time we'd flip the switch, all the lights would dim down, and we'd reverse the cylinder, and then so everybody in the whole house knew when I was Vitamixing from the noise and the electrical change.
Yeah, I wasn't going to spend all that money on a Vitamix. I thought, that's crazy. And then finally, when my blender died and I got the Vitamix, I said, man, that was crazy. You waited so long to get the Vitamix.
Yeah, because it's astounding how you can.
Yeah, it is really a phenomenal machine.
That's great. That's awesome. And Terry, just thank you for taking the time to have this conversation. You know, I want
You're
to
welcome.
be able to have your story known by more and more people, because I think you're really leading the way in what is the kind of a hybrid of public health and functional medicine.
Yes,
yes. How do we take this highly individualized medicine and make it far more widely available?
You know, so in 2007, I have trigeminal neuralgia. My pain is more frequent, more severe, more difficult to control. When my pain turns on, I'm going to the pain clinic, getting injections every day. I'm taking IV Salumedrol. It's not turning off. It has to take 5 days. Now I'm up to 5 days of Salumedrol to turn it off. And so I had come to terms with, I'm becoming bedridden. I'm probably going to become demented. I may well have intractable trigeminal neuralgia, where once it's turning on, sound, light, a breeze, swallowing, speaking causes incomprehensible pain. That was the future I was facing. And so the amount of gratitude that I have is that that's not the future that I'm living. So I'm very happy to be teaching and having this purpose, that if I can come back from that level of being at the edge of the abyss, our patients, there's every reason to think that they too could come back.
Absolutely. And that our pain is often our greatest advocate. When our symptoms are something to honor. They tell us something is wrong and will drive us to new and hopefully more effective actions. So embracing our dysfunction like you did, and being very honest with holy crap, look at where I'm headed. Because there are people in your situation who could still live in denial, and who could still go, woe is me, there's nothing more I can do.
Nothing more I can do.
And because you are a highly learned professional and really always thinking.
It's because I had young kids at the time. It's like, oh my God, I gotta do everything that I possibly can.
Wow.
For as long as I can.
Wow.
Like a true mom, you do a lot more for your kids than yourself. I was thinking about my kids, okay, I have to model resilience, I gotta do everything that I possibly can. And so that was a huge motivator for me. And now I just have this immense gratitude, okay, I got my life back, so I have to let other people know that they can be getting their lives back. And now I have to teach other clinicians how to do this. I teach the public how to do this. And I do this crazy research with my protocol with pretty amazing results. And so I'll have to come back sometime. We'll tell you about the next study we're going to do. It's going to be so exciting.
I am going to look forward to that. And a whole bunch of trails here,
we'll have more. We'll have more.
It's a great conversation.